Alright, so here's our next video, conjunctival pedicle graft performed on a patient. This is sped up at about 2.5 times in order to make this video edit a little bit more efficient. So try your best to grasp the conjunctiva minimally with your colibris. Don't re-grasp a lot of the time. Your blunt dissection could be a little bit more aggressive there by opening up the jaws further. But good job undermining it, but you really want to undermine first, then make that limbal cut, then come back and make this cut. But you're doing a good job right here. This all looks really good so far. Okay, good. Minimal handling. You measured it, you laid it over, you put it back down again without touching it and manipulating it. So that's a good move right there. Good placement of your colibri to do your keratectomy. Those were very intentional cuts that lined up great. Nice work. Nice keratectomy. I think that's an okay adjustment there, but that looks like it's going to lay in nicely. I don't feel the need that you had to necessarily do the extra irrigation there. You just irrigated just literally a minute ago. Roll your hand there a little bit more when you're pulling the needle through. Just kind of roll it rather than pull it. Small change, but I would have cut the loose end first, left the long end with the needle. That way, if that's the last suture you're cutting, then you can just immediately take that suture and turn it into your next step, which here is driving your next cardinal suture. So it's a small step, but it'll improve your efficiency a little bit. Stop with the irrigating so much. You don't need to irrigate the cornea this often. Good placement. A little bit of a better roll there. Yep, roll it. There you go. Good job. Stop irrigating. You are wasting too much time irrigating. Actually, one comment I don't remember if you had an assistant surgeon in on this one. So if your assistant surgeon is irrigating, then you're not wasting any time. If you're the solo surgeon on this one, which now I remember you did have an assistant surgeon on this one, so maybe it's not you irrigating. So that's my bad. If your assistant surgeon's doing it, then that's totally fine. They're not wasting any time that way. So my bad. That's all good. You're doing a good job so far. There's a little bit extra tenons right there on that side that you're working on right now, but I did see you obviously try to rectify that by thinning that out. Minor critique, not that big of a deal. In a perfect world, you would thin that out a little bit more, but Again, very, very, very minor critique. I know you're a little bit worried about that throw. That's the one that you discussed with me shortly after surgery. I think you did a great job here of moving that tissue and making sure that your placement was correct. So I have no problems with how you just managed that. That all looks really good. All right, that's it. I think you did a really nice job on this. Great work. So no major complaints on this whatsoever.